Welcome back to Studio Chatter. Are things getting a bit blurry for you these days? Let's welcome Dr. David Jones of Advanced Family Eye Care to the table. Welcome.
Thank you.
Hello, Dr. Jones.
It's good to be here.
It's good to have you. We have a lot of good questions.
Oh, I'm excited then.
Let's start with when you're in your 40s. Why are we noticing changes all of a sudden?
You know, when you get to your 40s, you lose the ability to focus your eyes. Mm-hmm. So your whole life, you've been able to do this really easily, go from distance to near, and it just hasn't been a problem.
Right.
But when you get to 40, the ability to focus starts to slowly go away.
Why? Is there a reason for that?
It can get complex. It has to do with the lens inside the eye and some mechanical forces that allow it to change its shape. And so it's probably a little too deep for here, but it happens.
Okay.
Yeah.
Anything to change that?
Yeah.
Eat more carrots?
Doesn't help. No.
It's too late.
It's going to happen. It's going to happen to every one of us. I thought I was going to be immune, and it happened to me. So if I'm not immune, nobody gets to be immune.
Okay.
So no, but there is technology coming that is going to greatly change this. And some of it's available now, and some of it's just becoming available.
Tell us more.
Well, there's several different ways of going about it.
Okay.
Everything from an implant they put in the front part of your eye that just allows you to have better distance and near vision and can kind of solve that problem, which I'm considering having right now, to actually taking away that lens that's lost its ability to change and replacing it with a new one that gives you distance and near now.
Wow.
And
So if you're replacing
that's working
it with
really well.
a new one, is it like a cadaver lens?
It's not. It's actually a plastic lens. So it's very similar to cataract surgery. So they're basically doing cataract surgery before you need cataract surgery and replacing it with a new lens that has really cool technology. It's called extended depth of focus technology, which allows you to have distance and near. And I've been seeing a few of these patients now, and they are doing really well. This is the one I'm most excited about.
Who have had it?
Yes, who have had it, yeah.
And will you be doing that?
I don't do the surgery. I don't do surgery, no. But I work with surgeons who do.
Wow.
But it's been really successful. It's been working really well. And so that's exciting. It's out there. There's other techniques that aren't as invasive. That one that I'm looking at isn't as invasive. And it's been working very well for patients as well.
So what's the advantage to seeing an optometrist such as yourself to maybe get a decent pair of reading glasses with instead of picking up, the readers at the dollar store or Target or wherever?
Yeah. Well, it depends on the person, really. For some people, that's an okay option. Now, my biggest issue is you need to get in and have your eyes looked at for health reasons. We find not only vision problems, but health problems by having an eye exam. When we're looking in your eye, we can see things that tell us about the health of your whole body. And so, really, what's the reason to come and see me? It's not necessarily to get glasses. It's to make sure the health is good, not of just your eyes, of your whole body, and to make sure everything's going well that way. Now, for most people, however, we can prescribe exactly what you need for reading glasses. You tell me what you need. Is it the computer that's blurry for you, or do you have a special task you're trying to do? And I will custom design something just for that, and for each eye individually as well. So for most people, there's benefits to having a custom pair done. But for some people, a pair of readers works just fine, but we can tell you that, plus look at the health.
So another reason I was interested in inviting you to the show was I had my 6-year-old daughter in, and she was having some trouble seeing things, and you were able to prescribe some corrective lenses for her. So how do you tell her? What are the advantages for, a 6-year-old compared to a 40-year-old? Or, how do genetics play into this?
Well, genetics play a role, but they don't tell us everything.
Okay.
So what we really need to do is take a look at kids. For me, one of the most important things I think people can do is get their kids in to be looked at, because kids don't know how they're seeing. The world's been always how it is. If it's been blurry, they don't know it's blurry. And there's other things we need to look for as well. And one of the really things that we're really big in my office is making sure people are looked at so they can know vision impacts learning, vision impacts how you perceive the world, and so you really need to get those kids in and get them looked at. At my office, we're part of what's called infancy, so we will see kids starting at 6 months old.
Oh, wow.
That young.
Really?
And we do those for free. Between 6 months and a year, we do them for free because we want to find problems early. One of the most frustrating things I find as an optometrist is when I get a kid in who's 11 and 12, and now they're having vision problems, and we look at it, and it's something we need to fix when they were 3, 4, 5. And we can't do anything about it now. And that's very frustrating for me. And so we want to make sure kids are seen early. We want to make sure that they're, ready to learn, ready to attack the world. And so it's important to get those kids in early. We like to see them, like I said, between 6 months and a year, at 3 years old, then before kindergarten, just to make sure that they're ready to go.
And I'm always curious, when a child or a toddler or an infant even when you're giving them a test and they're unable to read or identify some, how are you able to see or help them understand what they are seeing, or how do you do that?
It's funny. One of the oldest skills that we have as optometrists, and one that's not really used that much by a lot of optometrists anymore, is the ability to just look at an eye and focus it yourself by shining a light in the eye, seeing the light on the back of the eye, and focusing that. It's something I do on just about every patient because I want to keep that skill, because that's how I figure out how a 6-month-old needs glasses. I can look in and tell myself. Or today I had a girl in with autism, and she is totally non-communicative.
Okay.
But I can make sure she's seeing the world the best she can. So that the things that are important to her, she can see well. And that's a skill that I practice on almost every patient because I want to stay sharp at it. Because I think that's important,
Well, Dr. Jones, you're conveniently located in our city.
You bet.
Tell our viewers how to get a hold of you, where to find you.
Well, you can find us, our office is right by Macy's, and so you'll see it there, right there. You can certainly call us. Our website is Eye Care Spanish Fork. You can look on there and find information. The only other thing I want to I think the one thing that really is different about our office is our culture. And
I would agree.
Most patients who ever come in, they just say, I didn't know eye care could be fun. We really hire people that love working with people and that make life fun. I love working there because all I hear is laughing most of the time.
You do have a great staff.
They're wonderful. They truly are. So
good for you.
Yeah. So thanks.
Yeah, and if you're a well-behaved patient, you have really great cookies
we
too.
do. Every patient gets a cookie.
Thank
Very
you, Dr.
good.
Jones.
Thank you.
Thank you for having me.
Definitely.
Coming up next, there is a great big new building by the sports park. Let's find out what that is. Don't go anywhere.